Kia ora everybody, thank you for joining us with our Feeding Pēpi and Childcare workshop today. This is our part one of a two-part series, and we're very lucky to have our co-facilitators from the Women's Health Action Group with us today. We're just going to start with our karakia. Me karakia tātou, tūtara mai e runga, tūtara mai e raro, tūtara mai e roto, tūtara mai e waho. Kia tau au te Māori tū, te Māori ora ki te katoa. Haumea, huia, taeke.
Kia ora.
So we're going to be covering in this session information around breastfeeding, what mixed feeding looks like, and also how we can support our whānau who are doing formula feeding. In part two, we cover off the introduction of solids. So my name's Leslie Perry and I'm a Senior Nutrition Advisor for the Heart Foundation. My background, I'm a paediatric dietitian, and I was very passionate about bringing this topic to early learning because I also breastfed, also did some complementary feeding, and also used donor breast milk in my breastfeeding journey, plus formula. So feeding can look different ways for different Pēpi. And we've also got Isis Mackay. Sorry, is that?
Yeah, Mackay.
Sorry, Isis, who has a public health and health promotion background and enjoys challenging mainstream definitions of success and health. And she's currently the General Manager at Women's Health Action. And for the past 15 years, Isis has led the development of the National Infant Feeding Strategies, policies and events. She is our co-chair for Aotearoa Breastfeeding Network and a member of the Infant and Young Children Feeding Committee. Isis is passionate about creating more inclusive and strength-based approaches to support every whānau to achieve the best infant feeding journey. She's also joined by Megan Boxall, who is our wonderful health promotion lead at Women's Health Action. She's also a New Zealand registered dietitian and has a certificate in promoting public health. Megan's co-chair the Aotearoa Breastfeeding Network and leads World Breastfeeding Week activities and various other health promotion events. Megan has also developed several health resources and contributed to a number of strategic plans. As mum of two, Megan has both breastfed and formula fed and understands the challenges that each feeding journey brings. She's also witnessed firsthand how support, especially from early learning staff, can make a positive impact on the breastfeeding journey. I'm going to pass over to our wonderful facilitators.
Oh, kia ora, Leslie. Thank you so much for your introductions. Kia ora, everyone, and welcome to our session on Feeding Pēpi in Childcare. So in addition to my mahi, much like Leslie and Megan, I'm also a mama. I'm mama to three, and this session is really important to me personally. I started my own journey with ECE and breastfeeding over 12 years ago, and it was far from simple. So on behalf of our whānau, thank you so much for taking time to watch this session. And I warn you, you will hear breastfeeding more in this, the word breastfeeding more in this session than you probably have in any other time of your life. So let's get on with it. So from our experience, talking to whānau, ECE, kaimahi and published evidence, we know that people working in early childhood centres have not always had the opportunity to learn about the importance of breastfeeding, the public health recommendations, and how you can support whānau to achieve their breastfeeding goals. This session is intended to be a safe space to learn and to share. It is definitely not coming from a place of judgment about any one person's individual feeding journey. This session is intended to build on the significant knowledge that you already hold, develop a greater understanding about the importance of breastfeeding and the current infant feeding recommendations, to give you all the tools and tips to support breastfeeding friendly early childhood education settings, and to support whānau who need to or choose to formula feed. So why breastfeeding in general? I'm sure most of you already know that Manatū Hauora, or the Ministry of Health, and the World Health Organization recommend that children should be exclusively breastfed for the first 6 months of life, with continued breastfeeding to the age of 2 years and beyond. We know that protecting and supporting breastfeeding is a key determinant of public health, that supporting whānau to breastfeed is a core part of achieving optimal wellbeing and nutrition in those key first 2,000 days, We also know that early introduction of inappropriate foods and drinks is of concern in Aotearoa. And this means any food other than infant formula or breast milk before 6 months of age, or before 5 months, actually. So in regard to exclusive breastfeeding, I guess technically this means no other liquids or foods other than prescription medicines are given to Pēpi. So it's important that we do not give or encourage whānau to give any other food or liquids until Pēpi and whānau are ready, which is usually around 6 months. We also want to support breastfeeding because most parents are aware of the benefits of breastfeeding and intend to breastfeed for at least 6 months. However, in Aotearoa, only between 17 to 22% of tamariki are exclusively breastfed to around 6 months. This tells us that many whānau are not receiving the support they need and deserve to achieve their feeding goals. We know that parents want to do their absolute best for their children and that they can sometimes feel significant internal and external pressure and guilt when they have not been able to achieve their goals. This is all about trying to help people to achieve what they set out to achieve in the best ways that we can, removing some of the barriers that we know exist. So, why breastfeeding in an early learning setting then? Well, we know that over 181,000 children attend early learning services every year, and over 47% of these children are under 2 years of age, and 16% are under the age of 1 year old. So that really clearly falls within those World Health Organizations or Ministry of Health recommendations in regards to feeding, continuing to breastfeed children up to the age of 2 years and beyond. So we clearly have a responsibility in this space. We also know that evidence shows us that ECE centres influence breastfeeding practices and decision making and often lack the systems and structures to support breastfeeding. We also have the introduction of Ruataki Whakamana, the National Breastfeeding Strategy, and the strategy includes the recommendations that ECEs implement policy and training to ensure that early childhood education centres are breastfeeding friendly. So this session is going to give you a step up in that space. We also know that parents themselves take on the burden of trying to support breastfeeding within their own childcare settings. For myself, what this meant was actually creating what I think will go on to become the fact sheets and templates that we're going to share with you later in this session. I created these templates, fact sheets myself, put them on the fridge at my own centre, just taking on that responsibility of trying to help educate them so that they could best support me in my own journey. We also know that increasing the exclusivity and duration of breastfeeding has been shown to positively contribute to the health and well-being of both breastfeeding parents and their tamariki. For instance, for breastfeeding parents, this includes lower rates of postpartum hemorrhage, postpartum weight gain retention, and depression. It also protects against many chronic illnesses such as invasive breast cancer, uterine cancer, and ovarian cancer, type 2 diabetes, osteoporosis, and reduced bone density later in life. And these protective factors here are connected not only to that exclusive breastfeeding period, but more and more in evidence, it's shown that it's connected to that duration. So the longer that we support whānau to continue to breastfeed, the better. And this might look like someone who is mixed feeding or formula feeding to start off with, that increases their breastfeeding over time. For tamariki, this also is protective for respiratory infections, type 2 diabetes, gastroenteritis, otitis media, obesity, sudden unexpected death in infancy or SUDI. And these are just some of the many wonderful benefits. But it is really important that we understand and communicate this information in a population health context rather than as individuals. Because as we discussed already, people do carry that guilt and feelings about their own journey. And in fact, we actually, as educators, as kaimahi working in this space, can also be impacted by our own journeys and how we communicate that information to other people. So, and this means really we know people who've breastfed, who have gone on to develop breast cancer, for instance, or children who have been breastfed that might suffer from respiratory infections or ear infections. But the evidence is really clear and it's constantly reevaluated. It is clear that breastfeeding helps protect us as a whole population. So we know the benefits. We know that whānau want to breastfeed, but this is not happening for many people. Initiating and sustaining breastfeeding is a multidimensional and complex issue. We know that this includes a lack of knowledge about breastfeeding, a mode of marketing of infant formulas, that breastfeeding is not the social norm always, that people receive a lack of support from whānau and professionals. They might feel embarrassment about feeding in public, lactation problems. This includes things like sore nipples, engorged breasts, mastitis, actual or perceived issues with milk supply. The list goes on there. Conflicting information is another really important piece of the puzzle there. And this is also something that we can help to address by skilling in terms of our knowledge in regards to breastfeeding and infant feeding, so that we're not unintentionally providing with whānau with conflicting information. We also know that returning to work is an important factor there, and that accessing supportive child care is a big part of people's supportive journey in terms of infant feeding. So we've learned about why breastfeeding matters. We've learned about why it matters within an ECE setting, and that the barriers that people face are multidimensional. And I'm going to now hand over to Megan, who is going to help guide you through the current recommendations and how you might implement these guidelines into your service. And because this is a pre-recorded session, we know that some of you may have questions or thoughts based on the information that has been provided. At the end of this session, we will give you our contact details so that you can get in touch and continue this conversation with you if you like. So kia ora, Megan.
Kia ora koutou whānau, ko Megan toku ingoa. We're really excited to bring you this session today. So like Isa said, there's a lot of conflicting information out there. Parents can feel quite anxious returning to work and needing to juggle breastfeeding or bottle feeding with the start of an ECE. So we're going to touch on a few tips and tricks that might help. We're going to look at some current recommendations, the fact sheets that will be available to you to pick up and use today as well. So, like Isa said, current recommendations are to exclusively breastfeed until 6 months of age. And from about 6 to 12 months of age, breast milk is the main source of energy for a breastfed baby. And ideally breastfeeding up to 2 years or longer. There's no cutoff point in time that breast milk is no longer nutritious. It continues to be nutritious and has health benefits for both the parent and the breastfed baby, as long as that parent is able to breastfeed. If your baby is not breastfed for whatever reason, a commercial infant formula is the only suitable alternative to breast milk in the first year of life. Recently, you might have seen that the World Health Organization changed its infant feeding guidelines to say that cow's milk was acceptable from 6 months old. However, this was based on low-grade evidence and took into consideration developing countries who don't, for example, have access to fresh running water to prepare formula. So it's up to each country to determine what is appropriate for their population, and our New Zealand Ministry of Health has looked at the evidence and has advised that cow's milk is not advised in the first year of life. So either an infant formula or breast milk is the only source of milk. And that's because cow's milk isn't a complete feed before one. It doesn't contain enough energy and it's not nutritionally equivalent to breast milk or formula. So, like Isa said, in that first year, breast milk or full fats cow's milk, ideally given after meals. If we're giving it before meals, After 6 months old, it can fill up tiny tummies too quickly. And after 2 years, you can transition to light blue cow's milk or continue with breast milk. For parents of babies and toddlers who follow a vegan diet, ideally breastfeeding as long as possible. And that's because some plant-based milks like almond milk or oat milk aren't a good source of protein, iron, or B12. So ideally breastfeeding for 2 years or more. And as I've said, if formula feeding, sorry, Isis, can pop back one. If formula feeding, no cow's milk before 1. And you might see follow-on formulas. This is really just a marketing gimmick. It might be called a stage 2 milk or a toddler milk, but really transitioning to that whole fat cow's milk after a year is perfectly fine. And for most children from age 1, cow's milk, along with a balanced diet, should be sufficient to meet their nutrition requirements. So these are the documents that will be available with this session for you. You're welcome to pick these up and use them as they are or adapt them to suit your service. So we're going to go through the handling of expressed breast milk, the handling of infant formula, and I'll talk through a wee bit more about what is in the Feeding Pēpi milk procedure guide. So I'm sorry if these are quite small on the screen, but they will be available with you for you with the session. So feeding express breast milk, the first thing I wanted to say is a few people are unsure about where breast milk should be stored. In Te Ao Māori, there's some things that are considered tapu, like blood, that can't be stored in a refrigerator, but breast milk is not considered tapu. It is safe to be stored in a refrigerator next to food. So all express breast milk, and I'll just explain fully what express breast milk is. We got that question last time. So just for clarity, express breast milk is milk that a parent has pumped or milk drawn from the breast using a breast pump, for example, that you can store and feed to a baby later. So all express breast milk, or EBM for short, needs to be stored in an airtight container, and it's really up to the parents to be labelling when that breast milk was expressed, and it's your job to be able to use the oldest one in the fridge first. So ideally storing all of that express milk in the back of a fridge or the back of the freezer where it's coolest. And if possible, if there's room at your ECE, we don't want to be running out of any of the milk. So if there's an option for parents to store a bit of extra milk, that's a really great option. This is a really handy table, and we'll give you an A4 version and an A3 version that can be printed out and stuck up on the fridge. But breast milk is a living food. It's got all these amazing immunological qualities. It's got antibodies that provide immunity and fight off bacteria. So unlike formula, breast milk can be left out at room temperature for a lot longer. So on a really warm New Zealand summer day, up to 32 degrees, up to 3 to 4 hours is fine out of the refrigerator. If it's a slightly cooler day, 4 to 8 hours, but ideally no more than that 4. If it's in the fridge, up to 3 days is absolutely fine. And then depending on the type of freezer that you've got at your service, if it's a small freezer box, 2 weeks is perfectly fine. If it's a separate door fridge freezer, up to 6 months. And if you've got a deep freeze, breast milk can be stored there for up to 12 months. So express breast milk needs to be handled and stored carefully to minimise bacteria growth that could harm Pēpi. So as with anything, washing your hands before feeding or preparing breast milk. And ideally, it's up to the parents to be providing sterilised bottles or cups for the service. So for all Pēpi under 6 months, all bottles need to be washed and sterilised. And when tamariki are over 6 months, just washing bottles and equipment in warm soapy water and rinsing these well is perfectly fine. So thawing and warming breast milk. We really want to retain these nutritious immunological qualities that I spoke about, and we do that by ensuring the milk doesn't get too hot. So we're not wanting to thaw or heat any of the express milk in the microwave. It can easily overheat or heat unevenly, which can be a burns risk. So the best way to warm breast milk is by placing the cup or bottle in some hot water and then gently swirling the milk to distribute that heat evenly. As you can see in the picture on the right, breast milk can look quite different to formula or cow's milk. It can be quite yellow or slightly blue. And to give an example, if the breast milk's looking slightly blue in colour, it might be that baby's fighting an infection and the parent's body is making antibodies to fight that infection, which is amazing. You can also see in that picture on the right, there's a little bit of separation of the fat at the top. That white line there is the fat that's separated in the fridge. That's perfectly normal. We don't want to throw that away. We want to keep it. So just giving that a wee shake as the milk warms up. So a wee bit like the milk in the old glass bottles, you'd see the fat at the top, exactly the same thing. So just giving it a wee shake to mix it back in. So mixed feeding, what is mixed feeding? Mixed feeding is breastfeeding, bottle feeding, or both. So it could be breastfeeding and expressing some milk. It might be breastfeeding and giving some formula. It could be breastfeeding, expressing, and formula. Or if Pēpi is not able to feed directly at the breast, it could be a combination of expressing and formula. And what's really important is to help parents understand that each month of breastfeeding, every drop of breast milk, including partial breastfeeding, will benefit their baby. It continues to provide nutrition and immunological benefits both for Pēpi and for the parent feeding as well. So it's important that we're supporting people who are mixed feeding to continue with breastfeeding in a way that suits them. So, for example, I would do a feed in the morning, perhaps give some formula or express breast milk at daycare, and then feed again at the breast at night. So just finding out what works for that whānau. So moving on to formula, in terms of the water that we use for formula, it's important that we're preparing that water on the day and discarding it within 24 hours. So all of this is based on Ministry of Health guidelines, and again will be included in the documents you receive. So boiling and cooling that water on the day is really important. For Pēpi under 6 months, really important that we're boiling and cooling. However, for tamariki older than 6 months, it's perfectly fine to use tap water. It's good practice, as long as you're on town supply, good practice to run the tap for 10 to 15 seconds just to flush out any of the water in the pipes. And if you are on tank or bore water, it's important that it's boiled for all children under 18 months old. And it's also important to note if you're using bottled water is not sterile. So for Pēpi under 6 months, you also need to boil that bottled water for making up formula. So very similar in terms of cleaning and sterilising for formula and for breastfeeding. So you must sterilise, or parents should be sterilising all of that feeding equipment for all Pēpi under 6 months, and over 6 months is fine just to wash in hot soapy water. So ideally, like I said, parents would bring in sterile bottles. If for whatever reason your service is required to sterilise, there's many ways you can do this. One of the easiest and cheapest is on the stove, which has got instructions here. You might also have a steam steriliser or a microwave steriliser. So just finding whatever suits your service. So I'm sure you guys can do this with your eyes closed, but just a wee reminder for preparing formula, always following instructions on the tin. They can differ slightly from brand to brand. Always adding the water first. If we add the powder first, it puts the ratios off, which can make Pēpi quite sick. And same with never adding more or less formula or water than recommended either. Similarly with breast milk, we're not wanting to overheat the formula, so avoiding microwaving. You can actually give breast milk or formula cold. That's perfectly fine. It's really down to the preference of that child. But if you are heating it, similarly with breast milk, popping the bottle into a bowl of warm to hot water and just giving it a gentle swirl to make sure it's heated through evenly. Unlike breast milk, formula isn't a living food and it can grow bacteria a lot faster. So it's really important that we discard any unused formula within 2 hours. It can't go back into the fridge. It just doesn't have those same antibodies or immune factors as the breast milk does. So looking at responsive or paste bottle feeding, first of all, documentation is really important. You need to be recording the amount of milk consumed and the time of every feed. So I'm sure you've got charts. We've also in our procedure guide got some feeding charts that are available for you to use as well. So we want, ideally, this picture is really lovely here. It's mimicking, for example, a breastfeeding position. And you'll note that the bottle is horizontal, it's not tipped up vertically. So we're wanting to keep Pēpi in a semi-upright position. And stopping and checking regularly. We're not wanting to encourage Pēpi to finish that bottle, just being guided by them and how much they're wanting to drink at that time. And we're wanting to make it an enjoyable experience for the both of you. So holding baby close, maintaining eye contact and talking to baby while feeding. And ideally switching sides during each feed can help baby to with some neck and eye control as well. If baby falls asleep, it's really important that we stop feeding. That can allow milk to pool around the teeth and gums, which can lead to tooth decay. And really important not to put any Pēpi or tamariki to bed with a bottle. They can draw fluid into their lungs and aspirate or choke on that fluid as well. And it's also important to note that a breastfed baby might take smaller amounts of milk than a formula-fed baby, so they might need kind of smaller bottles, but more often rather than kind of a 200 ml bottle of breast milk. So this one's really important. This is the HS23 bottle feeding licensing criteria. And these are regulations around bottle feeding that we must comply with to not prop up children while feeding or leave them unattended while having a bottle. So this applies to services licensed for under 2-year-olds. And it says infants under 6 months and other children unable to drink independently are held semi-upright when being fed. Any infant milk food given to children under 12 months must be approved by the child's parent. So it's really easy to assume that this is just for formula when you hear the term bottle feeding, but of course this includes breast milk or any other fluid given in a bottle as well. So it's really just important that we're making sure children are always attended and never left propped up with a bottle. The bottle versus cup. Ideally, by the age of 12 months, we're wanting to move to an open cup. We know this can be really, really messy, but it is better for the child and hopefully will mean less cleaning up for you if there's less teats and less bottle tops and things to wash. So benefits to using an open cup: it supports the development of appropriate swallowing and drinking skills for Pēpi, helps to develop important fine motor skills and coordination, promotes speech and sound development, and helps to reduce the risk of tooth decay. So giving them lots of practice with an open cup from the age of 6 months is awesome. So there are many ways in which you can support whānau, and I'm sure there's a lot of these that you're doing already. One of the biggest things for me when I first enrolled my wee one at ECE was just having the chance to talk about breastfeeding at the time of enrolment, and just knowing that the service is supportive of receiving express breast milk, or even allowing that parent to come in and breastfeed during the day if that was suitable for the family. So it's important that you're creating a breastfeeding and whānau-friendly environment where parents are comfortable to breastfeed or express milk. And it says here it's important to have a private area, but it's also great to encourage parents to feed in public spaces if they're comfortable in doing so. Isis told me about a really lovely example of when she would pick up her wee one and she'd breastfeed him in front of the children there. It was a real kind of learning experience for those children, and Isis said it wasn't long until the toddlers were kind of breastfeeding their dollies at the chest as well, which was really cool. So assuring whānau of the procedures and practices around breast or bottle feeding. So informing them or showing them your breastfeeding and infant feeding policies, and sharing the feeding records back with the whānau each day as well. Another friend was telling me how an ECE service would let her know at the end of each day how much expressed breast milk was left in the fridge or the freezer at the service. And this kind of gave her reassurance that the ECE was thinking about these things, but also took the pressure off her not having to produce a heap of breast milk that night if she already had some left over at the ECE for the following day. We all know that feeding doesn't always go to plan, so the biggest thing you can do is just offering reassurance to parents that you're willing to try different approaches, experiment We all know that tamariki are very adaptable and often will do things at ECE that they don't do at home. My little boy didn't sleep at home. He slept like an angel at ECE, so I think you guys are absolutely amazing. So just reassuring parents that these things can take time. Our ECE were incredible. My little boy wouldn't take a bottle, so they use an open cup or a straw for a long time, which was amazing. But just reassuring parents that, yeah, it can take time. You could use things such as a slightly slow flow or a newborn teat if the baby is breastfed and taking a bottle, as breast milk comes out quite slowly from the breast, so that can kind of simulate that as well, or even warming the teat on the bottle can help a little bit. Often parents and you can experiment with different teat types as well. So a slightly longer and more narrow teat can kind of simulate and mimic what a nipple would look like in a baby's mouth. Oftentimes it might help if there was an item of the parent's clothing with your ECE when you're feeding. You can just try lots of different things, and I'm sure you've got many tricks and tips up your sleeves as well. You can also support your own kaimahi, your own staff, to continue to breastfeed their Pēpi whilst at work, if suitable, and if that's something that they want and need. And you can inform whānau that by law, they have the right to breastfeed at work. So employers must be giving unpaid breaks to breastfeed or to express milk. So this is an example of the procedures and policies that will be available to you. So like I said earlier, you're welcome to adapt these or pick them up and run with them. So this is the Feeding Pēpi Milk Procedure Guide. Inside that, you've got the breastfeeding policies, you've got the A4 manuals for handling breast milk and handling expressed milk, formula. It's got ideas and flyers in there that you can use in your enrollment packs as well, talking about breastfeeding, transition feeding, mixed feeding, starting solids, etc. And just having a look here about the key documents that services need. So the must-have policies, which you can use the ones we've given you, procedures for storage, preparation and heating of milk. So these are the two examples here. A record of what was fed and when it was fed. And it's really important that there's training for staff. So that includes new staff, old staff, and all of your relievers as well. And a couple of nice to haves, like I said, there's flyers for enrollment packs that encourage parents to ask you about all of these types of feeding. And it can be really lovely to have breastfeeding friendly posters or images up around your ECE. If you're not sure where to get those from, you're welcome to reach out and we can help you with that as well. So that's all for me. I'm going to hand back over to Isis. Thank you all so much for your time, and please do reach out if you have any further questions.
Mike. Thank you so much for taking time to watch this part 1 of Feeding Pēpi in Childcare. We encourage you to now go on and listen to part 2 with Leslie Perry on Feeding Pēpi, an introduction to solid foods, if you haven't done so already. If you need to get in touch with the Heart Foundation for nutrition support for tamariki, they have nutrition advisors in different regions across the motu, and you can find their details along with recipes and other heart health tips for tamariki on their website, or visit the Kahu Manawa or the Healthy Heart Award platform. If you would like to get in touch with either myself or Megan at Women's Health Action, we also have the website listed here. And to find your local breastfeeding support for whānau, you can look up www.findyourbreastfeedingsupport.org.nz. Thanks again for listening. Kia ora.
Kia ora, Isis. We really have appreciated both you and Megan sharing your wisdom today, and I'm sure there'll be lots of questions from your talk today as well. It was great to have that update, so thank you very much. Me karakia tātou. Tūtara mai e ranga, tūtara mai e raro, tūtara mai e roto, tūtara mai e waho. Kia tau ai te Māori tū, te Māori ora ki te katoa. Haumea, huea, taia. Thank you, everybody. We also have the resources listed, so if you are wanting to see some of the resources that we have, we can send those out through our nutrition advisors as well, so just get in contact with us. We look forward to seeing you in part 2. Ka kite anō.